Good morning, everyone. I hope that you can hear me. Good morning. I'm Vasilis Kouranos. Thank you all for coming to this webinar that we have made it an annual event with SarcoidosisUK and Royal Brompton Hospital Sarcoidosis Department. This is part of the Sarcoidosis Awareness Month, and our plan is to increase the education for both patients and carers regarding sarcoidosis. We have designed this webinar trying to increase the patient's interaction, and we have asked you to provide us some questions that our consultants will later on answer. I'm very happy to be part of the Brompton team and primarily working with Athol Wells, who has helped us with his ideas in the management of sarcoidosis that you will later hear from all of our colleagues. We also have in our department Dr. Elizabeth Rengioni, Dr. Felix Chua, Dr. Peter George, Dr. Phil Molyneux, as well as Dr. Maria Kokosi. And we have recently had joined Dr. Richard Hewitt, and we have been trying our best to provide sarcoidosis patients the best management. I will hand over to the Sarcoidosis UK executive, Leo, who will have a few words to say from the Sarcoidosis charity perspective. I would personally like to thank Sarcoidosis UK for their support and the ongoing engagement in the patient's care. Thank you.
Thank you, Vasilis, and hi everyone, and welcome to the annual Sarcoidosis UK and Royal Brompton Sarcoidosis Patient Day. My name is Leo, and I'm the Senior Executive here at Sarcoidosis UK, and it is a real pleasure to be here with you all, so thank you for being here. I want to start off by saying a big thank you to Dr. Kouranos and the Brompton Sarcoidosis UK, the Brompton Sarcoidosis team for working with us on this important event year after year. It is always such a fantastic event and is really appreciated by so many of us. So a heartfelt thank you to you all. And also thank you again to everyone who has joined today, who's watching and learning with us. Really great to have you here, and I really do hope you enjoy the day. Now, before I go into my introduction, we are going to show a short video from Sarcoidosis UK Chair of Trustees, Sue Wilson, who would like to welcome you to this event. So let's play Sue's video, please.
Welcome, everybody. On behalf of Sarcoidosis UK, I'd like to welcome you to our annual Patient Day. I'm Sue Wilson. I'm the Chair of Trustees. I've been involved with the charity for 7 years. They were recruiting in 2016, and when I saw the advertisement, I replied straight away. My son has sarcoidosis, and so as you can imagine, it's an issue that's very, very close to my heart. My work background is in finance and governance, and until fairly recently, I was working with a women's support charity. I left that role last year, and when we had some changes at Sarcoidosis UK, I had the capacity to step up into the role of chair and take on that extra time commitment. There's just 3 things I want to touch on today: the needs of our community, the engagement of our community, and the generosity of our community. We are here to meet your needs. We did that during the pandemic, and we're doing it now. We can all see that the NHS is under a huge amount of pressure, and therefore the work of charities like Sarcoidosis UK has never been more important in providing information and support and raising awareness of your needs. And how do we know what to focus on? And that's because of your engagement and the feedback you give us. So thank you very much for all your responsiveness through responding to surveys, calling us, engaging on the Facebook forums, and also in the support groups. You tell us what's important to you. And thank you too for sharing with us and with each other. It really matters. And the third thing I want to touch on is your generosity. We can't do the work we do without your financial support. We're totally reliant on everything you do for us. So thank you for your donations, for your regular support, for your fundraising, for considering us in your wills. You are here for yourselves and for your families. You are here for each other and the wider community, and we want to be here for you. Thank you.
Thank you, Sue. Now let me just share my screen as I have some slides. Okay, so I have some very exciting updates to share with you today, but first, just a little bit about the charity. Sarcoidosis UK was founded in 1997, and we've been helping people with sarcoidosis ever since. As a charity, we have 4 goals, and they are to provide support for people with sarcoidosis, which we do via our nurse helpline and our support groups, to provide detailed and accurate information to people affected by sarcoidosis and medical professionals, to raise awareness of the condition amongst the general public and the medical profession, and to fund medical research into sarcoidosis. As I said, there are some exciting updates to share with you. And the first thing I wanted to talk about was our new project with the Royal College of GPs. So this is an e-learning course with the Royal College of GPs that we are incredibly proud of. As many people on the call today will know, with sarcoidosis, diagnosis can take a long time, which can be extremely stressful for patients, and misdiagnosis is also common. We know that early diagnosis and referral to specialists will deliver better outcome for people living with sarcoidosis. So the role of GPs is vital in this, and we need them to have access to accurate information and training about sarcoidosis, and we need them to be more aware of the condition. So we have created an accredited online education module, which is free to access and provides GPs with the knowledge to identify and manage patients with sarcoidosis. I also wanted to note here, because we have had some questions, this course is also open to any primary healthcare professionals as well. So this is an extremely important project for us, and the members of our clinical board were involved, as well as one of our Sarcoidosis UK nurses. So this really has been a team effort that we are very proud of. And of course, we want to make sure that as many GPs as possible are accessing this course, and we would really appreciate with your help in spreading the word. So you can encourage GPs to complete this course in a number of ways. If you have a look at the information on our website, you'll see that you can download an email template that you can send into your GP practice, or we also have information cards that you can order, and we'll send them to you for free. Just small little cards the size of a small postcard that contain a QR code that your health professional can scan, and it will take them to this free accredited sarcoidosis course. So please do order one of those, and we will get it sent out to you free of charge. Next up, research. So I specifically wanted to talk about our 2017 research project, which has recently finished, and we have now received the final report. I wanted to share some key findings with you all from this, but we will be releasing the full report in the coming weeks, so you can have a read yourselves too. So in this study, Dr. Stephen Fowler and his team at the University of Manchester conducted research into exhaled breath gas in people with sarcoidosis to help identify causes, predict progression, and response to treatments. So the study involved collecting breath samples from participants with sarcoidosis, and the analysis of these samples showed 3 things. 1, that sarcoidosis appears to be associated with key differences in several exhaled breath chemicals. 2, breath chemicals are closely associated with the diversity of microbes in the lung in sarcoidosis. And 3, levels of some breath chemicals are different in the breath of people with sarcoidosis according to the severity of the disease. So this is actually the first study to investigate breath tests for monitoring and characterizing sarcoidosis. which is very exciting, but it means that it's a preliminary study and therefore that any benefits to patients will occur in the medium to longer term. But if these results are confirmed in a larger scale study, then these findings will improve outcomes for patients, or might improve outcomes for patients through more accurate diagnosis of the cause of sarcoidosis, which could lead to more targeted treatment. It could lead to better prediction of the severity of disease and prognosis. And also we could find out a bit more about the understanding, get a bit more understanding about the role of infection in sarcoidosis and therefore better treatment of infections. So this is very promising and we are very excited about these results. And we do look forward to sharing the full final report with our supporters in the coming weeks. So please do keep an eye out for that if you would like to find out more. And okay, one last update from me before we get started and we begin session 1 of our patient day. I want to talk about our new condition insight report on sarcoidosis, which we have created for personal independence payment assessors. So sarcoidosis is a very complex disease. There are lots of misconceptions out there about it, which can make seeking disability benefits a real challenge, as often assessors might not fully understand the condition that they are assessing. So to address this problem, SarcoidosisUK has created a condition insight report for Capita's PIP assessors. And we made sure that this report contains accurate, up-to-date information about sarcoidosis. It emphasizes the systemic nature of the condition and also highlights the extremely varied and often debilitating symptoms that can present and addresses those misconceptions that I mentioned earlier. Capita have accepted our report and I can confirm that it will be the only source of information that they provide to assessors about sarcoidosis. So we can be more assured that the information that they are providing to assessors about sarcoidosis is a more accurate representation of the condition than some of the guidance that they might have been accessing in the past. So we hope that this report will improve awareness of sarcoidosis amongst PIP assessors, and we hope that it's a step forward in helping individuals who live with the condition receive the support that they deserve. Okay, so we're close to starting our first session. I just wanted to touch on a few things to finish off my introduction. First of all, please do get in touch with us on info@sarcoidosisuk.org if you require any support with your sarcoidosis. If you have any questions or you are interested in booking a free call with our nurse helpline, or perhaps you're interested in joining a support group, anything really, we are here to support you in any way that we can. So please do get in touch if there's anything we can do. Secondly, we are a very small charity. We're a team of 3 in the office and we don't receive any government funding. So none of our work is possible without the donations of our supporters and the fundraising of our supporters. So if you are able to, please do consider donating to Sarcoidosis UK. You can do so at sarcoidosisuk.org/donate. Any donation, no matter how big or small, is really appreciated and will really make a difference. So thank you to anyone who is able to support us in that way. And finally, thank you all for being here today. Please do get involved, ask questions and enjoy the event. And thank you once again to the Brompton team for giving up their time and making this such a special event year after year. We are really, really grateful to you all. Thank you. So Vasilis, I think
I will, Leo, I will just share my screen just to show the agenda.
Yeah.
Just give me a second. So what we will have is that we, I'm sorry, it's not the right thing. Do you have the agenda to share, Leo?
Yes, absolutely.
So what we have designed for this webinar is patients to share different sessions. So the 4 sessions will be chaired by members of our Brompton team, as well as the SarcoidosisUK trustee. And the final session would be a discussion between myself and Professor Wells in an attempt to put him in a corner and try to get the most valuable answers about specific challenging questions about diagnosis and management of sarcoidosis. The first session would be about pharmacological treatment options, and Dr. Chua and Dr. Renjoni will present and comment on any questions raised by our sarcoidosis patients. And the second session would be by myself and Dr. Peter George, where we will try to answer questions about non-pharmacological treatment options. Dr. Sharma will present a few things about the cardiac involvement of sarcoidosis on the third session, and the fourth session would be presentation by Dr. Victoria Sinkari, consultant neurologist at Chelsea and Westminster and Charing Cross Hospital, who is participating in our joint neurosarcoidosis clinic, where she would present data about the neurosarcoidosis. Now, what we have, the way that we have designed this patient day is that we have asked 4 different, as I mentioned, patients to chair the sessions, and we have asked all of you to provide us with some questions ahead of the presentations. These questions will be grouped by the chairs, and after the presentation by the consultants, some of these questions will be answered. We will also try to answer any of the questions that you will have live on the day. So I would move on to a short break for 10 minutes, and about 10:30 we will start with Dr. Chua and Dr. Renjoni.